as we have gathered evidence from the American Heart Association's Go Red for Women campaign, we know that the relationship between a patient, a woman, and her doctor is one that is sacred. And it has to be a partnership. And we now embrace and encourage, women to find a doctor or a healthcare team, because it could also be a nurse practitioner that they have a trusted relationship with. And if you think of a partnership is where you get to know what matters to the other person. And when it comes to heart disease, we know from the American Heart Association that 80% of heart disease is preventable. The American Heart Association has also shown that lifestyle changes have a huge impact on preventing and controlling risk for heart disease. You put that into perspective and you recognize that our lifestyle changes, the 80% of our time and when we're taking care of our health is outside of the medical encounter. So therefore, co-creating a heart healthy plan with your physician, with your nurse practitioner, with your healthcare team is important. And so you have to have a trusted relationship, and it has to be with a physician who recognizes what matters to you, what your lifestyle is like, and you can have better outcomes. I always tell my female patients, when you're coming to see me, I am your partner. We're doing this, we're co-creating a plan. And I always say you should prepare like you're going to your accountant. Think about it. If you show up to your accountant without any evidence, you're never going to get a refund. In fact, you might end up paying, right, where you shouldn't be. So I think that in a partnership, you have to prepare for the visit. Because as a physician, as a healthcare professional, I'm not sure what's going on in your life for the past, 6 months before you've seen me or a year. So I think keeping a logbook and writing down your symptoms and coming prepared to say, 3 months ago, while I was walking up a hill, and I'm just using patients' examples, I noted that I was short of breath. That is important information. Or your family history, also important. So I think coming prepared, knowing your family history, knowing what symptoms you're having, and especially now that we know pregnancy-related complications are a problem, coming in prepared to discuss your life, your medical history, all important in us co-creating a heart-healthy plan. Patients have to be proactive. Definitely, I always say we in the healthcare field as physicians, we don't have ESP, right? So if something doesn't make sense, absolutely, definitely ask for clarification. Also, and we learned this from the American Heart Association since we started the Go Red for Women campaign, the importance of health literacy. Because we in healthcare speak in parables, I like to say. We speak quickly, and there's a whole art to having a health literate conversation. And so also, we encourage women to definitely be proactive, to ask for clarification, but also the onus is on the healthcare professional to really speak in a health literate way. And by that I mean, instead of saying, as you're walking out the door, do you have any questions? Ask for a recount of what you have heard. The power of storytelling, very often I would used to ask my patients to just tell me, how are you going to explain this to a loved one? So truly in any partnership, clarity, communication is definitely important. When we started Go Red in 2004, there were major aims. One, to increase awareness among women and get women to be empowered, to be partners. The other was understanding the science of the sex and gender aspects of cardiovascular disease. And the third component was raising education among healthcare professionals. So I think if you were to look back at the history and the track record since 2004, we have used the science to publish the guidelines and to help the whole medical community understand, yes, women may have different presentations, the pathophysiology is more extensive, and here are algorithms that should be followed that are sex and gender specific. So it's an ongoing process, and I think the American Heart Association, in combination with the American College of Cardiology, are definitely leading the way in changing curriculum and scientific information for the healthcare community so that they're aware of the differences. The American Heart Association has partnered, or the Katz Institute for Women's Health at Northwell, which is definitely leading the way in terms of how we treat and see women's health in all aspects. And in cardiovascular disease, the partnership with the American Heart Association has definitely led to multiple educational sessions. So not only increasing awareness for all patients or women patients that come to the Katz Institute at Northwell, but additionally educational curriculum and educational symposium across the entire New York region for healthcare professionals. So not only physicians, but nurses, as well as the entire healthcare team. If at all possible, show up for your doctor's appointment with a friend, a family member, because I'm not sure, we're all going to be patients one day. I know when I go for my visit, and I definitely prepare, you sort of get in a trance a little bit. You're not thinking clearly, but you hear the words, and especially if it's sometimes troubling news, it just doesn't register. If you have a friend or family member with you who can take notes, who can be your advocate, definitely you get a more successful outcome. Because very often, I know myself, I've gone home and I'm like, what did my doctor say? And I couldn't put all the pieces together. So I believe having someone with you who can be your advocate, who can help you decipher the information, add clarity, ask questions on your behalf, definitely leads to a much more successful visit and successful outcomes. Self-advocacy is definitely important. And again, we come back to the underlying and foundational principle that you have to have a partnership with your physician, with your healthcare team. And in any partnership, there's always trust. And also, if there is trust, you need to have the ability to ask questions, to ask clarifying questions, to come up with a plan together, to co-create a plan. So speaking up, asking questions, following up with questions, finding out what the plan is, writing it down, adding clarity, tweaking the plan collectively or in partnership with your physician or your healthcare team is definitely important. At the end of the day, we always say, if you do not advocate for yourself, no one else is going to do it. And it comes back to having a friend or family member with you who is part of your cabinet, who will definitely speak up, where sometimes you may be afraid to do so, but there is strength in numbers, and partnerships are so powerful. And if you think about the power of partnerships, it leads to trust, it leads to your ability to adhere to a treatment plan, especially if you have co-created that plan with your physician. In medicine and in cardiology, we welcome second opinions. Science is evolving rather rapidly, and there are things that we know, there are things that guidelines change as more evidence becomes available. So in medical school, for example, we always would get together to discuss cases, and we know that diversity of ideas and thoughts lead to innovation and sometimes the right diagnosis. You translate that to patients. Patients need to recognize, they know their bodies, women know their bodies. If something doesn't feel right, getting a second opinion is definitely important. And in the medical community, physicians, nurses should be open to someone getting a second opinion, because we do not have the Bible on all things cardiovascular disease as guidelines change.